Welcome to Medical Sales Live, the #1 resource for breaking into medical sales and building your career.
Hey, good afternoon, everyone. My name is John Akers. I'm the Chief Operational Officer for the Medical Sales College. Welcome to another edition of Med Sales Live. Today, we have Kengpong Bhodiprasit, and he is here with us today. We're excited about this opportunity. I think Keng's story is a great one, and one that we're excited to share. So, Keng, welcome, my man.
Thank you for having me. Super grateful, John.
It's great to see you again, my friend.
For sure.
Hey, so why don't you kick things off for us and tell the audience a little bit more about your story. Where'd you grow up? What were you doing prior to coming to MSC?
100%. So I want to start off with my why, right? And this will lead to where I was born, which is Thailand. Stayed out there for 6 years, and my mom actually had the opportunity to come to America. And so, obviously, the American dream is super important. It's coming from a third world country. And so she brought my sister and I out here. My dad is in Thailand. And so we just try to build a life for ourselves. So, with every minority, parents, they go, hey, you got to be a doctor, engineer, lawyer. And I'm like, I don't know about all that now. So I was like, all right, well, let me get a good job for you. And so I became a nurse. Became an RN for my mom to live out her dreams. And so she got happy. She was super happy. And now a part of me was like, well, let me live out mine now. So let me start off with this being the nurse is being in the emergency department. Went straight out of school, went straight into the emergency department, and did that for a couple of years. And it was tough, and especially when the crisis came, it was pretty rough too, traveling and did all the crisis. Now, the big part of it was I felt too stagnant, really stagnant. I was like, okay, is this what life has to give? And this is where, okay, well, here's my dreams, right? How can I take a leap of faith to really dig into other maybe talents that are hidden? And so I called my dad in Thailand. I was like, hey, Dad, what should I do? What can I do? He's like, do something hard in America. I was like, what is that? Searched up Google. I looked at it and I was like, door-to-door sales. Door-to-door sales. People don't want to do this. Okay, let me try to do this.
All right, so you've gone from, wait, hang on. I just want to put this perspective.
Yeah.
So you've gone from the ER, right, as an ER nurse now to door-to-door sales.
Yes.
That's kind of where you're headed anyway. That's what you saw. All right.
Yeah, and no one knew it. No one expected it. They're like, Keng, you're crazy. Like, this is commission only. You're crazy. You already have a good paying job here. I'm like, well, let me just try this. I think I'll be really good in sales. So did door-to-door with Vivint, actually. And during that year, when I broke into the space of sales, I was a number 6 rookie in the Florida division. And then for season, which is the summer season, the whole 6 months, we went out to Austin, Texas, and I was actually the number 1 rookie in Austin, Texas.
All right, so tell us because I don't know that everyone knows what Vivint does.
Yeah.
So tell us what they are and what you were selling at that time.
So Vivint is going to be smart home and security.
Oh, okay.
Yeah,
Got
big
it.
competitors with like ADT, and I think you probably know The Ring.
Yep.
So selling that door-to-door, 6 days a week, just grinding it out.
And so what year was that? So could put some time frames in for us here. So when you were working as a nurse in the ER, what was the time frame on that?
So 2018 until I think last year. So the year prior, I was doing door-to-door.
Okay.
So the other years, I was doing nursing.
Gotcha. Wow.
Yeah.
So you were doing then the door-to-door sales was during the pandemic.
Yes.
Wow. How was that? How were people looking at you at that point in time? That is hard. I mean, Dad couldn't have given you a more difficult task, could he?
Yeah, no, I think it's definitely, he knew that, hey, this is a hard time. I think you should capitalize on hard times and resistance because that's going to be the best way to grow. And I didn't know that until literally I called him about like 2-3 weeks ago, and he's like, look, good things don't come from what's easy. Good things comes from what's hard.
Wow.
I'm like, wow, okay. So you knew it all along. He's like, yeah.
So what was if you had to, really trace back your success during that time that you were selling door to door, what would you say, what were those, 1, 2, 3 things that your attributes would you attribute your success to?
Oh, questions. I asked questions like no tomorrow. I reached out. If it was at 1 a.m., 12 a.m. and had a question on my mind, I will reach out and I will get that answer. Because I can't go to bed without preparing for the next day. And so I think that's just reaching out, really, and just connecting and networking is one of the biggest attributes, and then really just going through the motions.
Gotcha. Well, you'd mentioned a little bit about, when we first started talking, about your why. Mm-hmm. And tell me, is that Simon Sinek why?
Yes.
Okay.
Yeah.
All right.
Yeah, that's that played a big part on this whole journey too. So I knew about that. I read his book, I think 26 now, so about 4 or 5 years ago, and it really dug deep. And so that has been with me for forever now. So
no doubt. So what is your why?
Well, to give back to my parents, to give back to my mom, since she gave me an opportunity to really live out my dreams and pursue my dreams. It's now really to give them a great life because they give me the opportunity.
Oh man, that's moving. Congratulations, Keng.
Thank
so with that, then you've now been an ER nurse, right? And was that here in Tampa, right?
Yes. So I did that in Largo Medical, so HCA,
yep.
Baycare, and then I did my travel assignment within Advent Health.
Okay.
Yep.
And so you've got experience now in the hospital, but now you decide that, hey, I'm going to go out and do something hard. And you're doing door-to-door sales.
Yeah.
So at this point, how did you determine what was next, and how did you come across the medical sales college?
That's actually a great question. So during when I was just knocking on doors, and a part of me was like, well, sometimes I do miss, putting IVs into people, doing some skills, and really connecting with the doctors and giving like patient care, having the patient care, patient outcomes, seeing the patient get better. And it's significance. Yes, I am helping people with security, making them have like the peace of mind, but I want to create significance in people's lives too. And so after that year, I really contemplated and I want to do something more. How can I combine my talents and what I do love, which is sales, and also creating significance and helping people? And I was like, okay, well, there is medical sales, right? And I was like, there is medical sales. There's reps in the OR. I'm like, oh, so that's what they do. And then I want to combine the two, and I actually will lead me to how I found this medical sales college. So tried for a month, literally 11 p.m., 12 a.m. I would always just scroll on LinkedIn, look at videos on how to crack into this industry, apply to many places, nothing.
Really? I mean, even with that medical background?
Even with the medical background, believe it or not, so I have family in Chicago, which are cardiologists, cardiothoracic surgeons, GI doctors, pathologists, and everyone that works in the medical in the hospitals. I was like, hey, can you just send me numbers of your reps? They're like, yeah, sure. Even those connections, I couldn't crack. It's like, what else? What else? Until one day, literally, I think it was like 11 o'clock at night, 11:30. I saw one of the alumni for MSc. I was like, how did this guy get into, it was Stryker. So how did this guy get into Stryker? Like, what is different? What's different here? I clicked on his profile. I scrolled down. I was like, what is this?
Was that on LinkedIn?
It was on LinkedIn,
okay.
Yeah.
Yeah.
What is this? Medical sales college. I've never heard such thing. There's a college? Was I supposed to go to school for this? Like, what? This is crazy. And that actually led me to finding out what medical sales college is.
So from there, you just did the research on your own, I'm assuming.
Yes.
Okay.
So I went onto the website. I was like, oh my gosh, okay. this looks pretty legit. What's the licensing? Like, okay, they got licensing. So, okay, like, this is their placements. This is their background, their track record. It's like, well, they have a proven track record. Why not just go for it? Like, so many people will spend so much money on different things. Why can't I just invest myself into having a bigger ROI in the future with medical sales college? I was like, wait a second. Looking at the average pay, I was like, seriously, this is nothing. Like, looking at the bigger grand scheme of things, come on.
Absolutely. I mean, certainly listen though, regardless, I think that is an experience that everyone has, right?
Yeah.
I mean, it's that investment in yourself. I think that, everyone wants to bet on themselves, but there is a financial, hurdle that we all, and that all students have to get over and find that way to pay for that. Was there any other, questions or trepidations that you had prior to coming?
Was this course going to give me everything I needed? Was this going to give me the knowledge? What else could this course have to offer besides just lecture, skills, and sales skills? What else? And people won't know this until you guys starts to reach out, is that you don't just get the lectures, the skills, the sales skills. You get the whole family. You get the whole team. And when you reached out, John, you're like, hey, Keng, like, if you have any questions, please let me know. That's when I was like, all right.
And that was right after you were accepted, because I sent you I sent you an email, right?
Yeah.
Yeah, exactly.
And I was like,
exactly.
All right. These guys follow up. These guys are on it. And even the COO followed up.
We know that students come here not just to learn about hips and knees. They come here to get a job and to get into the industry. And granted, you've got to be capable and ready for when that time comes. But, that's where our job comes as well. And I know that, as we see students like yourself that are this driven, this motivated, and this determined and capable when they get into the industry, we sincerely want to help and do everything we can. Rich and I didn't have to do a whole lot for you. So why don't you tell the audience kind of how things unfolded and why you're sitting as an employee of MVP Orthopedics here.
Yes.
So share with us what happened.
So Tilden Register, one of the instructors of MSC, he brought in MVP Doug and Melissa. Mm-hmm. So Doug was the VP of sales and Melissa was HR, and they sat down. And Tilden actually told us the day, I think 2 or 3 days before, saying that they're going to come. And so this is like, all right, this is my time to capitalize. How can I capitalize on this time? How can I ask questions that would be not only engaging to Doug, which is the VP of sales, and then also get him to think about me a month from now?
I love that. Because you're spot on. That's the same thing. You're selling, right?
Yes.
Yep.
And so I want to make a name for myself.
Mm-hmm.
I had to. I believe that I felt like I was the underdog for some reason. That's why I had to really dig deep. Really, really dig deep. And when Doug asked the question saying, like, who's read this book? I answered. And I really think that stuck out to him because on our first interview, he was like, Keng, dude, your questions that you asked me, you're driven. Like, you asked really engaging questions, and I still remember to this day. Some along those lines he said, and he said, like, hey, you're going to be a great value to the team.
Congratulations. That is so cool. But again, that's thorough preparation makes its own luck, right? And you certainly embodied that as you went about that. And tell us, when did you get your offer?
So I got my offer 11 weeks in, but there was a lot of, for me at least, with LinkedIn, it's great help. With LinkedIn, I reached out to Melissa, which is the HR, and Doug. I kept following up really to see if there's any opportunity afterwards. Because, I mean, the interview and then getting the job was great, but it's the work that was put in between.
Sure.
Because Melissa was like, hey, Keng, there's a lab. I was like, when's the lab? I'm going. Showing up, meeting the team. Actually, during the lab, too, I met with the owner of MVP. I didn't know it, and they're like, Keng, dude, you really spoke really well with the owner of MVP. And I think that stood up with the team, met the team, and then week 11 came. Keng, we want to do an interview. And first interview, Doug was like, Keng, you're going to be a great value to the team. I already know it. He told me all the logistics. I want to give you a verbal offer. Shook hands.
That's so exciting.
And I was like, no way this just happened.
Well, and so what I'm hearing, though, that would not have happened had you not been so, persistent, appropriately persistent, and prepared.
You've prepared, persistence, over and over and over. I think it was when opportunity meets preparedness, you get what people call is luck, but it's not.
Makes
really
its
luck.
own good fortune, doesn't it?
It does.
It does.
It does.
That's awesome. Keng, thank you so much.
Thank
we are
you.
so proud of you, man.
Thank you for having me. And for those of you who are listening, like, I can't thank this program enough, and the people and the team that are on it, everyone there. I'm just so grateful. And if there's one big thing that you want to get from this is network and dig deep, because once you dig deep, it really shows. I never thought it would work, but it worked with reaching out and just being consistent with it.
Absolutely. Congratulations, Keng.
Thank you.
Proud of you, my man.
Thank you so much,
Best of
John.
success.
Thanks for tuning in to Medical Sales Live. Remember to like and subscribe to this channel for the latest in all things medical sales.